Blaze, well, it is Wellness Wednesday, and a lot of people experience intense foot pain, and plantar fasciitis is one of the most common causes. So if you have pain in your heel, we've got SSM Health orthopedic surgeon Dr. Sara Galli here to explain more about this disorder. It's good to see you, my friend.
Thank you for having me.
Yeah, and you even brought in a prop too. I love this.
Yes.
So let's dive into it. What exactly is plantar fasciitis?
It's a term we all hear. It kind of gets coined alongside heel pain, but what it really is irritation, inflammation of this thick band of tissue that starts on the heel on the bottom of the foot and goes out to our toes.
Ooh, okay.
It's tight when we're up on our toes and standing, and then it's loose when our foot is in a relaxed position.
Okay. And you saw a lot of this after the COVID-19 pandemic. So why is that, you think?
You know, I think COVID was a change to all of our normals. People who worked in the office were working at home. People all of a sudden had their only source of activity to be walking. And so whether it was people who were working at home, all of a sudden spending their days in their slippers, their house shoes, or even barefoot, that change is enough to irritate the plantar fascia. We also saw a lot of people getting outside with their kids, with their significant others, a lot more, and just that increase in walking, maybe not wearing the best shoes because they were grabbing what they could. And any of those changes, I think, is why we saw so much more of it during COVID.
So tell us, what are some of the risk factors with this disorder?
You know, anyone honestly can get it. It can be couch potatoes that get it. It can be people training for a marathon. It can be people that are seasoned athletes. But what we commonly see is some change in someone's normal. So they change a pair of shoes. They go from being a 5K distance runner to being a marathon runner. It's some change from what your normal exposure of activity to your foot is, and you suddenly increase that activity without properly preparing your foot for it.
So what can people do to treat this type of disorder? Do we just put some ice on it and hope for the best, or?
You know, honestly, that is a lot of it.
Okay.
Ice really is a great treatment for inflammation, but a lot of it also is, you know, what caused it, identify if it was a pair of shoes, a training program that was too aggressive, and kind of ease up from the activity that was the originating agent. But then a lot of it is also stretching, making that tight plantar fascia tissue that you've really irritated more supple. And so you're doing a lot of stretching of the bottom of the foot. You put water bottles in the freezer and you roll your foot on that frozen water bottle. And a lot of times letting, you know, nature take its course and let the body do what the body does best, and it will resolve itself.
And you touched on this a little bit earlier. Can physical activity cause this?
Yes, unfortunately, I never want to discourage my patients from being physically active. That's obviously an important part of anyone's life. But when you change that amount of physical activity rapidly without properly preparing your body for it, physical activity can be linked to it.
All right, and what can we do to prevent this so that way we don't have to be faced with something like this?
You know, a lot of it is just being smart and looking into the training program when you're going to do a new activity, or if you're going to do something for a prolonged period of time, make sure you have a good, well-fitting pair of shoes on. I think stretching is a good part of any routine that we have, especially when we're doing more physical activity. So quick stretch before and even a proper cool down afterwards. All of those can kind of help from that tissue getting irritated.
All right, and is there anything that we can do, you know, or when do we know that we should go to the doctor? Because I'm somebody who, you know, I don't like to go to the doctor, but when is it enough is enough and we need to go see a specialist?
You know, I think if you're training for something or you go on a vacation and you come back with heel pain, do the usual stuff that you do first. You rest, you ice, and do those things. But then if it starts to become something where you're changing your daily routine, people are asking you, what's wrong with your foot? You're limping. When you start seeing those changes impact you day in, day out, you know, a couple weeks to a month of that going on, I think it's at least worth having a conversation, because there are some things that plantar fasciitis can mimic, notably stress fractures, that you don't want to be missing in the setting of just being like, oh, this is heel pain. It's plantar fasciitis. There's some things you don't want to ignore.
All right, Dr. Galli, thank you so much for being here. A lot of great information, and we'll be sure to put all of this online at WKOW.com.